This is the number one exercise to unlock a tight low back if you have a herniated disc or you've thrown out your back or otherwise have a hard time getting on the floor bending because of your back. My name is Dr. Aaron LeBauer from LeBauer Physical Therapy. I've been a physical therapist and massage therapist for over 20 years, and I've helped thousands of people with their back pain, and I've even helped myself. So a few months ago, I had a really acute episode of low back pain, and recently I was visiting a friend who's having some back issues as well. And there's one exercise that's a modification of a cat and cow that I'm going to show you how to do to really unlock your back. You can get any kind of band. This is a gray Cook band, it's called, with some foam pieces, but any elastic band is going to work. This is perfect if when you bend you feel really a lot of tightness here in the low back. It's also really good because a lot of times when people have low back pain, they stop moving here and they move more higher up. So a cat and a cow is on your hands and knees, and you arch your back, drop your head, lift your tailbone, drop your stomach. A lot of times that hurts or it doesn't feel good, especially if it's really acute. So you can take a band and you wrap it around your low back here. Okay, and I'm going to take my two hands and press forward, put them on the ground. And then now as I do the cat and cow, I have resistance. But the resistance shouldn't make it harder, it should make it easier and feel better. So when my back was in a really tight spasm, this really helped feel better. It also, because of the resistance, engages the core. So you're going to take your band, hands and knees, arch your back, inhale, lift your tailbone, drop your stomach, go the other way. And what you're going to do is you're going to do 3 to 5 reps of this, 2 to 3 times a day or 2 to 3 sets, whatever feels good. Sometimes it'll hurt, and you can do these and it'll help it feel better. Just like this. There's another variation where you can kind of come to neutral, take one leg and stick it out, move it back and forth. And all these movements should be less uncomfortable than before. You can use any type of elastic band. So a couple principles to keep in mind. If it feels good, do it. Do more of it. 3 to 5 reps, 2 to 3 sets. If it causes sharp shooting pain, doesn't feel right, try to breathe differently. Try to set up a slightly different way. Maybe engage your core, your body in a different way. If it doesn't stop it, then stop the exercise. Look, if this makes it worse, that's totally fine. It means we triggered the symptoms, and what you need is a total body diagnostic with a specialist doctor of physical therapy. If this makes things better, just imagine what working together one-on-one is going to do for your body and your back. And in that case, what I want you to do is get in touch with us as well, because a total body diagnostic will help us unlock the root cause of the problem and give you a plan to fix it once and for all. And then the third case is this changes nothing. Like, you might be like, this doesn't do anything, it doesn't make it worse, doesn't make it better. What's happening there is probably the problem is somewhere else. A lot of times pain is referred, so maybe there's an issue in your hip and you're feeling it up here. Maybe there's something else that we need to take a look at, and in that case as well, what we would want to do is see you in our clinic and take you through a full body diagnostic exam and just determine, like, is this a muscle and joint issue, or is it something else, or is it where you feel it, or is it somewhere completely different, like your upper back, your leg, your ankles, your toes. It could be activity related. So what I would love you to do is give these exercises a try. If you don't have a band, try them without a band at first and breathe through it. Go to the gym, go to your CrossFit box, somewhere else where they maybe have a band. It can be in a full loop, or just one big long flat one, or a tube like what I've got. Give these a try. Try some and try breathing through it and seeing if you can keep moving, does it ease up? In that case, great, is probably a muscle and joint problem, not really a disc. There's nothing to blow out. There's nothing that can, like, that's going to do so much massive damage that you can't exercise ever again. There's always a way to keep moving and keep doing the things that you love, especially if it's exercise and mobility oriented. You just need to make sure you are getting advice from and speaking with a doctor who's exercises and works out, who specializes in movement, pain, and injuries, especially back pain. And that's exactly what we do here at LeBauer Physical Therapy. So I'd love to hear what's been helpful for you in the comments below. Be sure you hit the like, subscribe, click the notification bell, and find us over, there's links below the video on YouTube. Find us at Instagram at LeBauerPT. Send me a DM over there if you need some help. And I can even send you my book on back pain. Just go to the link below on YouTube or at LeBauerPT on Instagram. DM me the word book. I'll send you my free book on back pain. I'll see you on the next video. Adios.